Guys, my name is Nassim, and today I will be talking. The thought prompt that I chose is mental illness, and mental illness is defined as a disorder that affects your mood, thinking, and behavior, or it's even a combination of all of these things. It is associated with distress or having problems with functioning in social work or family activities. Nowadays, having a mental illness or mental disorder is common, but it's not widely accepted or even approved. Like, it's looked down upon, it's frowned down upon. A lot of people judge those that have a mental illness or mental disorder. In society, normal people are considered to be those who follow the world social norm, and they never question anything. Normal people they play along with whatever is told or asked of them. According to WHO, which is the World Health Organization, society considers people to be normal if they see their potential, they cope with the normal stresses of life, they're productive workers, and if they contribute to their community. It's crazy. It's considered to be those who suffer from mental illnesses or any type of mental illnesses or disorders, whether it be schizophrenia, bipolar disorder, autism, or even having ADHD, anxiety, or depression. Society considers those who are crazy to be weak, unpredictable, unproductive, and incapable of making rational behaviors and decisions. Normal is considered to be anything that does not interfere with your life, job, or family. However, crazy is considered to be any mental illness that negatively impacts you or affects you. In all honesty, personally, I believe that educating yourself on mental illnesses and disorders, being cautious of your words, and as well as watching what you say and how you say it will help reduce the stigma that is faced on mental illnesses today. There is so much shame and embarrassment that is placed on having a mental illness that makes the person that makes the person that has the mental illness or disorder feel alone and isolated from the world and society, which is not okay. The stigma and discrimination on mental illnesses today will make the problem worse. Honestly, it will be the cause as to why somebody doesn't seek or want to get help want to get the help that they need to feel better, if that makes sense. The stigma and discrimination that's faced on mental illnesses makes the person that suffers it worsens them. It makes them worse. It does not help them in any way. It's not beneficial to the person that's going through it. In all honesty, normal people don't understand what those that have mental illnesses go through. They can try and sympathize, but they will never understand it. We can also be more supportive and helpful and include everybody in social gatherings, parties, groups, etc. to reduce the stigma faced on mental illnesses. This does include inviting that shy kid from the class, or the person that has ADHD, or the person that's always down in class, the person that, you know what I'm saying. Just include everybody. Don't let anybody feel left out. Honestly, that's, I feel, how you can reduce the stigma and discrimination faced on mental illnesses. I feel that medication doesn't really cure the mental illness. Rather, it just makes a person feel more stable, comfortable, and calm. Medication will help the mentally ill feel more relaxed and at ease. But in all honesty, I feel like it's sort of like a placebo, in the sense that they can take it and they're gonna think it, and they can take it and think that they're gonna get better. Therefore, they start to feel better, when in reality, it has no effect on them whatsoever. However, if the medication improves your quality of life, then I don't see a problem with it. But I do think it's a placebo, because I really don't think the medication that mental illness patients take, it works. It's just a placebo. It's like a thought process. It's like a mind game, if that makes sense. So long as there are no harmful or long-term side effects, negative side effects, then I think it's fine that for mental illness patients to take it. But some medications, such as Xanax, which is used to treat anxiety and panic disorders, they have harmful and long-term side effects, and I don't think that's okay. Xanax is an addictive drug, and there's so many cases in which people have become drug addicts due to it. Once they stop taking it, they might find themselves longing for it and feel that they need it, or else they'll die. I do not think Xanax should be prescribed for for a majority of the patients that have like anxiety or panic disorders because of this sole reason. However, it does work on the person that has anxiety. If it does work on the person that has anxiety or like panic disorders, I get it, but like I don't think it should be prescribed because it's a very addictive drug. There are so many pros and cons to this prescription, as with anything in life. Literally, I feel like we should prescribe medication for mental illness for anybody, as age literally should not be a determining factor in helping somebody. And in addition to this, let's talk about how people that have schizophrenia, the medication that they take makes them look and feel like zombies. Like, they're not there mentally. That is not okay. It's really not. Like, this is another reason as to why medication is not always a good thing. And it's just, yeah. Medicine versus therapy depends on the person and how they view it. Some people might feel that medication works best, and others might view psychotherapy as the best way to cope with their mental illness. However, a combination of both medication and psychotherapy proved to be the most effective form of treating a mental illness. It all depends on the illness you're treating to be prescribed therapy or medication, in all honesty. For instance, if you're treating anxiety, the best medication would be a combination of therapy and medication. Both of those that combination works perfect. There are cases in which people that have anxiety say that combination works phenomenal for them. But a lot of people do prefer like medication instead of therapy because they don't even think of going to therapy. And honestly, there's not a lot of like tests on therapy and how well it works with people, because medication is such like the go-to. Like, nobody thinks twice when it comes to medication. They take it, you know. They're like, oh yeah, you know, I need medication, or what's psychotherapy, you know. In all honesty, I do feel that we have been over-diagnosing mental illnesses. Let's be honest, most psychiatrists and psychologists, they're quick to prescribe. They don't take a minute, like, they're quick to prescribe rather than taking a minute and listening, listen to what the patient is telling them. Like, they're so quick to diagnose a patient as sick because of what they are going through or how they feel at the time, when all they might need is a shoulder to cry on or an ear to listen to them. You know, I feel that a majority, I'm not saying all of them, but a majority of the psychiatrists and psychologists, they're quick to prescribe, and they don't listen to them because they want to get them in and out. You know what I'm saying? As somebody who suffers from ADHD, anxiety, and OCD, I can proudly say that there is so much stigma and not proudly, but you know what I'm saying. Like, there's so much stigma and discrimination around it. Like like mental illness in general, there's so much stigma and discrimination around it. There are several people who will find a person who has ADHD as a burden. Like, they can be like, a lot of people will view them as a burden. They can be like as too hyper or energetic, or like just too much. Like, a lot of people might not like somebody that has ADHD. Let's be honest, you know. Some people, it's just a fact of life. Like, they'll look down on you. They won't listen to you. They won't heed what you're saying. They'll completely ignore you. It's a fact of life. And in all honesty, that applies to any mental illness. Let's be honest, because you're different. You're not normal. You're considered crazy. I feel that some of the medication that's used to treat ADHD, such as Ritalin or Adderall, might be too much and have more negative effects than positive ones. Mind you, Ritalin and Adderall are both addictive drugs, just like Xanax. It can do more harm than good for most people. I will say this though, like, I am seeking medication for my ADHD and anxiety because I've tried everything to mellow it down, but nothing seems to stick or work out. I have tried psychotherapy, like, I've tried exercising, and I don't have that motivation. Like, it does not work for me. And that's the end of my, TED Talk. Tune in next time.